Chapin Hall is an applied research center, and what we mean by that is we need to generate knowledge that is useful to the people out in the world who are helping children and families. So we sit down regularly with public policymakers in our partnership agencies. We listen to the struggles that they're facing. We think about how research knowledge could be applied to those, and we mutually develop an agenda that will be beneficial both to that agency as well as to the field at large.
Our rule of thumb was that we were going to try and identify areas that we thought in 5 years or so would be on the policy agenda, and we could then be ready with good analysis and good problem formulation when it was ready for public discussion. Because the usual way this works is something comes to public attention, everybody decides that they don't know enough about it, they decide they better study it, and the studies get done several years later, and meantime the public agenda is onto something else. We knew that the child welfare system was going to implode, and we're ready when it did, with better information and ways of shaping the discussion and therefore the remedies that were sought. So we did some work on sports opportunities for young people, on the arts, and young people, trying to survey what was going on in the city and where the needs might be. This was an example of trying to take something that other people weren't talking about, other people weren't worrying about it, developing some facts, some decent analysis, a vocabulary for it, and trying to make it a subject of a public policy concern. And if you look today at the enormous activity and expenditures around community schools, around out-of-school time programs, you can see that this is a field that has developed now rapidly. Many of the national foundations started what they called community development or community revitalization initiatives. And we became the evaluators of a number of these initiatives. Our interest in doing it was to learn about what could be done to help communities to develop themselves in a way that they could be effective actors on their own behalf.
We're also working with numerous early childhood providers around the country to make sure that they are using the best designs to get the impacts that we would love to see for children as they start off life. In the transition to adulthood, Chapin Hall is probably best known for its work on youth transitioning out of the foster care system. We've now followed youth age 17 to 23, watching them leave the foster care system and try to get a start with the adult life. In the child welfare world, we're now working with 22 states and 2 counties to look at foster care, who comes into care, how long youth of different types, children and youth, stay in the system, and how policies affect the retention or return home or adoption of children.
What we need now more than anything is strong enough leadership to articulate the issues about children, and if it's strong enough, the policies will follow. Our job is to be ready with the policy formulations and the ideas and the good analytic work, which will help to set a direction for those policies.
So the future will see much more of a focus, I think, on the cross-agency experiences of children. We will continue to focus on child welfare, which has traditionally been one of our strengths, but we'll see ourselves working much more with child welfare and its relationship to other agencies. We need to pull together better our understanding of the public human service systems, the welfare system, the public health system, the child abuse and neglect response system, how those interact with communities and how community level interventions can help those systems do a better job.